Pleasure to invite some key insights from very honourable guests that we have with us today. Professor Vinod, may I please invite you to the podium to share your insights with us. Thank you. Please welcome.
Good morning. Namaste and my greetings on this very, very auspicious day of Ganesha Chaturthi. Indeed, a great day to begin new endeavors and to build on the existing ones. So, greetings. Excellency Ms. Kathy Partridge, Professor Sanjay Zorpe, Dr. Sanjay Shuklaji, my colleagues, leadership of University of Sydney on the dais and in the audience, leadership of Public Health Foundation of India, distinguished experts, leaders, stakeholders, partners and friends. On this auspicious day, to discuss partnership pathways, collaborative pathways between two great institutions is really, I'm honored to be a part of. I've been associated with the Public Health Foundation of India, head and heart both, for a long time, and I salute the far-reaching, pioneering, visionary work of Professor Srinath Reddy, and indeed now the current leader, Professor Sanjay Zorpe, and the entire team of PHFI. So I like a big hand to PHFI today. This institution has played a very important role, came at a time when India was transitioning from one level of public health research, thinking, institution building, capacity building to another level. And PHF has created a unique place, a historic place in this journey for the nation. So thank you, PHFI. I'm also very pleased to learn, sir, about the new developments in the space of communicable and infectious disease. I'd like to know more, and surely in my own work, my institution's work, be very happy to connect the dots, because there are a few things to happen, and I'll touch upon them, both for One Health and equally importantly for the National Antimicrobial Resistance Action Plan. I'll touch upon that very briefly. So we'll be very happy, sir, to build on, and I welcome the leadership in environment sciences and the infectious disease leadership of PHFI. University of Sydney, thank you very much for being here and being a friend of India. I was joking with the Honorable the Excellency that Quad is not only about strategic partnership, there's a lot more that can happen in the space of education and health and science in particular. So that's my first request now. Let's strengthen our bonds and strengthen our area of influence, the hotspot of action, excellence that we can build in this. Well, some of you who may not know what the NITI Aayog stands for, just a word. National Institution for Transforming India is the name, NITI, N-I-T-I. We are a successor institution to the Planning Commission of India, which was constituted in the early 50s. The Honorable Prime Minister transformed Planning Commission into NITI Aayog. And among our functions and the core functions, first and foremost is to be the national apex public policy think tank of the union government. It's a think tank function. We are chaired by the Honorable Prime Minister himself. So it's the think tank function. Our second area of work is serving as a bridge to the states for development, for collaboration, and we like to call it cooperative federalism and competitive federalism. So we bridge in the federal system to the states in the spirit of both cooperative federalism, that means working together, let's say for the vision of Developed Nation 2047, or improving let's say, tourism potential of various states, or improving the health system, and so on. But also competitive federalism. So we bring in that spice of competition, and we have rankings and indexes, which excites people, and we believe that's one way to go forward. And the third function is to be able to assess the implementation of the central government schemes and programs on the ground and help in defining the implementation thereof. So these are the three functions. In that regard, we will have opportunities to connect for such an important area, namely the One Health. We derive inspiration for One Health from the Honorable Prime Minister's words at G7 Summit in 2021. It was a virtual summit in a way at the height of COVID. And what he said was, one Earth, one health. One Earth, one health. He expanded the concept, and it then fitted very well with the G20 paradigm and action and all the endeavor that took place around that with one Earth, one family. So we stand by one Earth, one health, and indeed it is a clear recognition at the highest political level globally now that we are living in an interconnected world of humans, animals, both domestic animals and wildlife animals, and indeed environment. It's coming at a stage when climate change related issues are stark, visible to us, and are calling for huge policy responses. For instance, my organization is currently working to look at what would be the social, economic, and other imperatives for India to move toward net zero. If you go through energy transition from where we are toward net zero, what would it mean to building sector, for example, transport sector, health, livelihoods, displacement of people who are currently living in areas where coal fields are, for example. How will the jobs shift? What skills we will need just to get around to that vision of responding to the climate change. So it's really, complex times, and indeed collaborations of this nature where we learn from each other and we create new knowledge and policy pathways together is truly appreciated. I'd like to bring to your kind attention that perhaps more of this will come in due course, but let me set the stage, particularly for my Australian colleagues, that India has already embarked on or launched a National One Health Mission. National One Health Mission. It is underway. It's been approved rather recently, a few months ago, and it's being rolled out. I'm pleased to let you know a few strands of this. The four core aspects of this are pandemic preparedness, human and animal that is, integrated disease surveillance, strengthening prevention programs, and fourth, joint outbreak response. Okay? Pandemic preparedness, disease surveillance, prevention, and then joint response. Now the joint response part is very interesting. This initiative was taken by the Principal Scientific Advisor to the Prime Minister, the Office of the Principal Scientific Advisor. Principal Scientific Advisor brings together the science system of our nation, largely in the Ministry of Science and Technology, but I've been spilling over to some of these, ministries such as Agriculture, such as ICIM or the Ministry of Health, and so on. So it brought all this together, and that convening led to discussions and crafting of the One Health Mission. I'm happy to state that there are 14 central government institutions coming together. So you mentioned about silos and interdisciplinary, and you're going to hear more from our colleagues here, and you know it better than us. So 14 departments are now part of this. It includes Agriculture, Department of Biotechnology, Department of Science and Technology, the Ministry of Health, A very stellar role to be played by NCDC, and my colleague Simi is here representing NCDC, and so on and so forth. The list has ICMR, environment, health, Ayurveda, which is our traditional medicine, agriculture research institution, Council of Scientific and Industrial Research, and Department of Pharmaceuticals, and so on and so forth, and dairying and fisheries and so on, fisheries included. We are also then, this conglomerate reaches out to the states, reaches out to the private sector, reaches out to the partners, and indeed the larger civil society. In order to govern this, we have a steering committee at the level of the Honorable Union Health and Family Welfare Minister. So it's anchored in health. And the executive committee, the action arm stewardship, rests with the office of the principal scientific advisor. So that's how we have crafted. Maybe there'll be a formal presentation, I guess, but happy to state upfront. Like NITI, PSA, as I said, brings together silos. We at NITI also, our biggest strength is really to be able to bring the ministry systems and departments together within the union government because of the convening mandate that we have received from the government. Let me just build on this to say some of the elements of this mission. One, it talks about technology-driven surveillance. So the SOPs are being done, and very recently a mock drill was conducted in Rajasthan for a fake virus outbreak just under a week ago. So just an example. That we go together, we put data in one portal, data will come to NCDC, it will be shared, it will be responded to, so bringing integration. And then from there it moves, surveillance moves to its impact on clinical outcomes, human outcomes, animal outcomes, and then would be a guide for understanding the pathogens through genomic sequencing and so on. So that's one part. The second thing which has already been achieved is to create a network of BSL-3 and BSL-4 laboratories across the nation. Our labs are floating around here and there. They belong to agriculture, they belong to defense, they belong to Indian Council of Medical Research, they belong to and so on. And DST, Department of Science and Technology, DBT in particular. And some state governments also have BSL-3, and some are lying in the private sector. So a network of 22 BSL-3 labs across the nation has been brought together, and SOPs have been written up. We're going to break silos. This is what happened in COVID. The whole of government, whole of society, whole of nation response. And should a need arise, a BSL-3 lab that belongs to, let's say, the Defense Research Organization or to an academic organization or to ICMR will rise for that outbreak, whoever is located closer. So that has been achieved. SOPs have been formed, trainings have started. Then there is an arm which is still being built, is the response arm, the effector arm, developing medical countermeasures, and that's complex. That's about diagnostics, therapies, vaccines. Now that's complex because that reaches out to the industry and to research organizations and so on, but surely it's a part, and we are testing this capability quietly for Mpox at this very moment. Happy to state that one diagnostic for Mpox, since this outbreak became global outbreak announcement mid-August, we have a diagnostic within 2 weeks commissioned. So to me, this is working together, and these are the capabilities that we're talking about, and all this put together. And at least 2 vaccine candidates are being attempted to be developed, let me put it modestly. So the 100-day mission to be able to respond should the outbreaks arise using the One Health paradigm and other paradigms is the effector arm for which we need a very large body of work to be done. It's a mission by itself, to be ready in the private sector, research organizations, regulators, and nudging it, funding, collaborations, getting immunogens from Australia, for example. And by the way, you have the Nipah monoclonals, which we keep eyeing all the time, and we want this to happen in India. The next important part is engagement with the state that has been started. Trainings have been started. And one other part is international collaborations that are being built, and this event should also be strengthening that. And the last one, as I mentioned, the joint outbreaks have started to happen. I talked about the Mark 1, but the real ones have also happened for the Nipah outbreak, for example, that we had a few months ago. Also, an institution called National Institute for One Health it has been decided to establish one National Institute on Occupational Health under the leadership of our DG ICMR, Professor Bell. ICMR was planning to have this institution in Nagpur in any case, but after all this, the twist was that now this will be an institution for all. That means its staffing will be drawn from agriculture, from environment, from human health partners, the DBT, so it is an integrated, multi-partner, shall we say, multi-ministerial, multi-departmental system in which we break our silos. Now, Indian Council of Medical Research will only do that much. But when you have agricultural scientists will come and sit. Biotechnology scientists will come. Industry can come and sit. Academia can come and sit. PHFI can come and sit, and so on. So this institution has been approved. It's being built, and a BSL-4 lab will come there. Not eventually, I would say very soon, I guess, we will perhaps have 3 to 4 BSL labs. Currently, we have only one functional lab. So there will be 4 for us to be able to particularly contribute toward One Health. So that's my quick brief for the mission on One Health. I'd like to also make mention here 2 other interesting developments. One, that we are at the cusp of launching the National Action Plan for Antimicrobial Resistance, which fully respects the One Health paradigm. In that also is a core approach, and then 14 other departments have their own action plans. So there are 2 parts to that action plan document, shall we say. One is the generic national program. It assigns responsibility. It has 6 pillars: labs, communication, responsible prescribing, and so on and so forth. But then, very mindfully, and that's the job that we had the privilege to work with, for instance, we brought together these 14 players so that they also have their own action. So I know that there's an action plan by the Ministry of Environment, action plan by Department of Pharmaceuticals, by our Water and Sanitation Department, by Education Department, by Communication, Media, and of course Science, Fisheries, and so on. So there also the silos have been broken in order for us to work better. By the way, just to mention, as part of our strategy for One Health is also wastewater surveillance. But I'm also happy to tell you here that as a part of our Jal Jeevan mission, which is water mission, potable water mission, our nation is ensuring that all the rural households will have fresh water supply, tap water supply in all rural households. We moved from 17% coverage about 4 years to about 80%, 76, 77% coverage already done. The relevant part is here that as a part of this mission, the potable water quality is tested in villages in thousands every week and hundreds of thousands in a month. That water coming home, if you think it's useful for surveillance, it's available. Because testing is being done for the usual parameter, but this is available for us to keep a watch on, surely for antibiotics, and that's the commitment that they made, that they'll make it available for surveillance. Should it is needed for other things, it's available from across the country in a very unique way. The second development is that NITI Aayog had commissioned an expert group to prepare a report on future pandemic preparedness and response. As a successor to the work that happened during pandemic, three very eminent experts. Dr. Vinod, she was the ex-deputy secretary and scientist, and she worked during the COVID and responsible for vaccine, stewardship through Mission COVID Suraksha. She's a chairperson, and Dr. Soumya Swaminathan, chief scientist, WHO, and previous ICMR DG, and Dr. Sudhir Singh, who was the NCDC chairperson, National Center for Disease Control chairperson. So these three distinguished colleagues, have created a report which again sees things through the filter of One Health. So it assumes that One Health mission is there, One Health approach is there, and then, of course, talks about the future preparedness. And that report is ready. It's to be launched on the 11th this month. So these interesting developments may help you think about how the partners, the University of Sydney, PHFI, and other colleagues who are in the room may like to connect with the initiatives and connect your work to that. Last, my wish list for the university is essentially to build on what we heard from the Chancellor, essentially to say that there is a space for working together in research. I like to really see so much. This is the government paradigm that I've stated, but then a lot should happen in our academia. A lot more should happen in the academia. And clearly, that's about lab work, that's about pathogens, that's about vaccine candidates, that's about therapeutics, and future. That's about epidemiology, I should have said, starting with epidemiology. Learning from how we tried to handle and we succeeded, and partly we may not have succeeded in a certain way in the course of COVID. So learning from there, do we have a better way of learning to do epidemiology? One of the gaps that we felt at that time, I think it was a global gap, that these disease outbreak projections, forecasting, everybody was right and yet everybody was wrong. Can this be more accurate? It's a challenge. Everybody claims he, she, that institution was right because everybody was right. Okay, so close. And there were ways of saying it didn't work, but then I think everybody was not right as well. We had a great difficulty in trying to put the numbers in order to be able to estimate the response elements in terms of the effort that has to go, the resources have to go, the coverage has to go. For example, for how many beds do we prepare for in the early stage, in the middle stage? How many beds? So at one stage we thought, let's say, 100,000, looking at how the virus was spreading. Then we learned it should have been more. Next time we were prepared for about 300,000, but then our load was higher than that. Next time around we were prepared for much more, but the load was less. Can this be more accurate? Just a thought, may or may not be directly relevant to the work that you're doing. Working with PHFI, I understand policy space would be the main, science to action would be the main area of work, I guess. But yes, indeed, those are the knowledge products that we'll be very, very happy to know about, to help you refine those journeys so that they're connected to the emerging policy thinking and, of course, informing back and forth. With these words, very warm welcome. Congratulations for coming together, having a sustained relationship over such a long period of time. We adore you, and we look forward to much more out of this collaboration. The appetite is big. India aspires to be a developed nation by 2047. Our capabilities, our collaborations, our investment in science, our life expectancy, all this has to change in a quantum way. And please join hands to make that happen. It's good for the world, good for India. Jai Hind.
That was